it is very, very possible that a young, fit, no other risk factor person can have a heart attack.
So the other thing is, I remember, like, back in the day when I was doing my internship, there was this marathon runner who had bent down to tie his shoelace and he fell off. Right. And at that point of time, it was shocking because it was like, oh my God, he's so active, healthy. What is this? And he was already gone by that time because, they brought him in quite late because nobody expected it to be a heart attack
Yes.
or anything of that sort because he's young. He was like 20s and like
Mm.
active.
My view on it is anybody can have a heart attack. I see 20-year-old, 25-year-olds having heart attacks. It's very, very possible whether you're fit or you're not.
Mhm.
But you got to do your part in preventing it, is
Mhm.
my opinion, is my advice. You do what you can to prevent a heart attack. The chances of you having a heart attack if you're fit is a little lesser than a person who's having a sedentary lifestyle, is not moving at all. So obviously I will advise you to be active, to do go
Mhm.
work out, yoga, something, but be active. But that does not minimize the risk, and there are a lot of other factors, genetics, cholesterol, all of that also plays a role. It's
Yeah.
very difficult to convince people that a young person is having a heart attack. For me at least, it's very difficult when I tell them your son is having a heart attack. They're like, no, 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 he's young, he's fit, he doesn't have any other risk factors, there's no genetic. It's very, very difficult to convince them itself that they are having a heart, their son is having a heart attack. And so the care just keeps delaying. In
Right.
cardiology, the first 20 minutes of having a
Yeah.
chest pain is
Yeah.
very, very crucial.
Hmm.
So the podcast that you're doing is very, very good because people now are should be aware that it can happen to anyone. So don't delay treatment just because of disbelief. It is very, very possible that a young, fit, no other risk factor person can have a heart attack.
But they have said that the number of heart attack cases have significantly gone up after.
Yes, it is true. A lot of patients come with ectasia, not necessarily stenosis or an occluded artery,
Hmm.
but the troponin in the blood value shows that the patient is having a heart attack.
Okay.
Basically,
Hmm.
meaning your heart is not getting enough blood.
Hmm.
Patients who've had COVID before
Hmm.
or have taken any COVID vaccine have more chances of ectasia. Now it's for people who've had COVID, taken the vaccine.
Okay, so that's like that post viral inflammation like going
Maybe
on in
there's
the